The stars are bright, we own the night. The stars are bright, we own. The stars are bright, we own the night. The stars are bright, we own. The
Hi.
Hello.
Hi.
Sorry, it took me a minute to,
Oh, no worries. I was patiently waiting. It's okay.
Very good.
And I see, I guess I'm joined on my other account, so don't mind that. Not sure what happened, but
Because I was like, okay.
how are you? I'm doing good. I'm doing well. Thank
Don't we
you.
look cute?
Huh?
Don't we look cute?
Oh, thank you. You too. What are you sipping over there?
Girl, that's water.
Oh,
Fancy with my little metal straw.
yes, yes, yes. I get it. Anything that'll help you encourage to drink it, right?
Exactly. So, everybody, to another episode of No Better Time Than the Present. This evening, I'm very excited because I have my buddy here, my pal, Melvina Douse Manuel. So we've been working on this a couple of weeks now to give you guys a special presentation. This evening, we're going to talk about disparities in healthcare and how inequities affect everyone. So this is a conversation that was spoken about on a couple of the episodes of the series. We've kind of like hinted a little bit with certain conversations with certain speakers. And I was like, okay, maybe, we get the brain working. Maybe
Yep.
like, not a fly-by conversation. So obviously we can't hit upon everything this evening ever. We're going to delve a little bit into it. Melvina Douse Manuel is a New York State citizen public health leader, empowered patient partner, as well as health and wellness coach. Melvina received her certification as a citizen public health leader with Cornell University. Mel is also a certified empowered patient advocate under Project Peach, which is a collaboration involving Black Women's Health Imperative, Friends of Cancer, as well as Stand Up to Cancer. Sorry, I have to move this over.
No problem.
I'm dropping it. Mel aspires to see more representation of her community in conversations dealing with emotional and physical wellness. She is the founder of Mel's 2021, which is a site created that shares stories about wellness issues that impact physical and mental health, as well as the physical environment for people of color and their communities. It is her hope that this site resource can be a place to visit to encourage self-advocacy when it comes to wellness. Mel's 2021 is the destination to inspire, to inform you, and to empower you on your wellness journey. Welcome, Ms. Douse Manuel.
Thank you. Thank you. Thank you. And cheers to you. I'm so proud of you for establishing this platform. It's phenomenal. So cheers to you, flowers to you.
Thank you.
I'm excited to be here.
Yes, I'm excited to have you here as well. Yeah. Okay, this conversation, we're going to get down to the get down. But we're going to, we have it all structured and all of that.
Okay,
So,
I got my notes ready.
okay, very good. So tonight's discussion is a hot topic, actually, because I know a lot of people hear the word health disparity, and I don't think they really understand. So we're going to hit on what are the disparities, what is conversation about, why is it important, and what is really the reasoning of bringing up this particular conversation. So if you want to start from there.
Sure, sure, sure. So, what are healthcare disparities? So, disparities are the differences between two groups that stem from broader inequities that already existed, right? So, they're like, long lasting, deeply rooted. You often hear the term systemic, meaning that it's, built into the system. They're preventable differences that could hinder, one's ability to achieve healthy outcomes within certain communities, right? And predominantly it's communities of color that are impacted or other marginalized communities. In terms of, some of the top four that people may be, more um, aware of, you can look at disparities in terms of race and ethnicity. That's a big one. Gender, sexual ID or orientation, or geographical location. So, like where we live, rural area versus urban area. Um, just to put into perspective, and I know we'll probably get into this a little bit more with examples, but if you look at sexual ID and orientation, right, and going back to the HIV pandemic, I know we were kind of young then, but you still remember it, how it was received. There was a large stigma attached to it, primarily thinking it was a gay man's disease. And it took a minute for people to realize it wasn't a gay man's disease. And even if it was, any disease in any segment of a population is something that we all should be aware of. Unfortunately, you fast forward to nowadays and you're seeing the beginnings of monkeypox starting to take off. And one has to wonder, did we really learn anything from how we dealt with HIV? Because it seems like we're kind of in that same wheelhouse of rushing to say it's only this particular group that's impacted, when that's not necessarily the case. Another example, a lot of times what I do, because a lot of these terms, like you said, could be very difficult to understand, I like to compare it to entertainment. So when it comes to geographic locations, like I live in a big city. I was watching I guess you could say it was a docu-series, a six-part docu-series, or maybe eight, called Dope Sick on Hulu. If no one's seen it, I highly recommend you watch it, because it's interesting, because a lot of these opioids, I know I've been prescribed at some point or the other, so I think, it's a good idea to learn what is behind when you prescribe an opioid. But I bring that example to light because what that did was highlight how it ravaged a very small rural mining town in Virginia. you know, Doctors were prescribing it. They weren't aware of the impact, what the impacts would be, and it just tore through. Addiction just skyrocketed. Now, of course, every pocket of the country has addiction. We have it here in New York, but you have a lot more tools in the arsenal to deal with it. You have treatment centers for those that want it. You have rehab centers. I think you even have centers now where you could safely use drugs. So you don't have that in the smaller communities within the country. So that would be an example of, again, just looking at how drugs or addiction impacts where you live and what services or resources may be available to you.
It's interesting. You hit up some very important thing based on have we learned about things in the past, and we have not. So it's like a whole rigmarole. But what I will add here is, again, this is where advocacy comes in and you doing your research. So if powers that be are still doing things kind of, should we say, ass backwards, you can still do your due diligence as to understand, learn, and educate yourself in terms of how
Exactly.
you and your family and friends move forward. When we see statistics when it involves certain ailments, certain conditions, whether it's high blood pressure, whether it's cancers or different forms of cancers. We
Mhm.
also, sometimes we go by those statistics, whether people really pay attention to it or not. Um, but I think it's important to bring up here because specific diseases and prognosis and the survival, um, and those targeted numbers, they're usually based on a specific group. So usually when you look at, okay, what are the statistics of um, the diagnosis or whatever, or the prognosis, and then what are the statistics of death? And
Mhm.
usually we kind of get in a, you know, kind of get riled up when we see that, okay, well, it seems like in a case, which I've spoken about this before, when you look at multiple myeloma, which it still has that as a 5-year lifespan, which
Mhm.
is not the case. And again, everybody is different, but usually when they do a lot of these stats, it's based on people who may have taken part of these clinical trials. It's like this whole conversation is a mixture of different things. And it's
Exactly.
usually Caucasian men where you're drawing these numbers as if you're
Mhm.
going to die or if you're going to live. And you
Right.
have
Right.
5 years to do it. You know what I'm saying? And that's kind of, it's a slippery slope. But again, with advocacy, you learn and then you realize that, oh, well, that's not necessarily the case. You know what I'm
Mhm.
saying? So it's just to have that conversation. So I just wanted to add that little part. But let's delve a little bit more in terms of the different forms of disparities. So I know you went through 4, but if you want to like explain, delve a little bit more into that.
Sure. So, wow, there's so many examples. Sometimes you can have disparities that sort of overlap. One big one that makes headlines, I'm sure most people are aware of, in terms of, and I think it's important to highlight, like you said, obviously there are the top 7 that we'll talk about a little bit later in terms of health conditions. But when you talk about disparity, you really have to look at how it impacts just your routine things, right? So let's take, for example, having a baby. That should be routine in this day and age. We're not in a stone age. But yet, if you're a black woman in this country, your chances of dying just doing that routine thing are greatly raised because of your ethnicity you know um if you look at things that are more geared toward, let's say, chronic conditions like kidney disease, for example, sometimes the inequities or disparities are built into the system and you see the impacts that way. So there's several different things you could look at in terms of if you have kidney disease and you're trying to get a transplant or you're trying to qualify to be on a transplant list, there's a test that you normally do to test your functioning called the EGFR. Now, the EGFR score should be based on, whatever it's based on. But the added caveat for people of color is that they factor in race. So according to the Kidney Foundation, right now there's an ongoing debate and study realizing that this may not be correct. Race is not something that should factor in per se if everything else, all the other, indicators you're meeting. But what has happened, I don't know if it's still currently happening because it's up for debate, you may meet everything else to qualify for that transplant, but automatically you're knocked out because you're black.
Mm-hmm.
That can't be the case. Um, Another way to look at it is how are our medical professionals trained? What are the common stereotypes, if you will, or myths that happens when you're trained, as a part of the medical association. At some point, I would like to think that that's still not the case, but I think some doctors believe that because you're black, you can manage pain better. You have
Mm-hmm.
tougher skin is even something that I've heard before. And these are things that I can say personally I have witnessed or been a part of because I feel like my pain wasn't always managed in procedures that I've had. I didn't complain, But I know, when you look at things in hindsight, unfortunately, that's a lot of how you end up self-advocating, because you realize going through something that you probably could have did it better, or you could have researched it better. But in my situations, I've actually heard, I wasn't under where I couldn't hear what conversations were being had. I remember once when I gave birth to my daughter, I witnessed one of the nurses say, like, I was present, but not really present, kind of out of it. But I could hear other people screaming, like in pain, and I'm not gonna discount anybody's pain. And I would like to think that the people taking care of you wouldn't either. But I was very surprised to hear, what I guess you could say equated to a stereotype, because the nurse said something like, "Oh, Latin women tend to over exaggerate pain. She doesn't need anything." That again, I was so out of it, but conscious enough to hear that. Another time I had a procedure, and again, you're in recovery but half awake, whatever the case is, and maybe like two beds down, there was, I think she was a young person, young girl. I don't know her ethnicity, but I could hear a conversation say, somebody asking, like, she's in a lot of pain. I could see it, whatever the case is. Oh, she'll be okay. Let her wait to take the script home. I don't want to give her any more here. So again, this is not something that's made up. you know, these are realities. These are what your healthcare professionals that are charged with taking care of you, this is how they think. Not saying it's done on purpose. Again, it goes back to how are they trained? What are these misconceptions that are being fed to people or to folks? Another one I think that, and it's kind of one of my favorites, I don't know why, but it's something that we're all familiar with. When you go to the doctor, they put that little thing on your finger. It just tests your oxygen saturation levels. It was very pronouncedly used during COVID. And you and I would be out of luck, Yolanda, because our skin, the pigmentation, is a no-no. Can't read it, So that goes back to the way things were approved through the FDA process, right? Again, not necessarily anybody's fault, but when you referenced the importance of being included in clinical trials, we weren't included, obviously, when that device was, brought about, because if we were, somebody would have realized the UV lights or however they're using to measure the oxygen level doesn't do well on skin that's, colored. So that goes for blacks, that goes for Latinos, that goes for Asians, Again, if you're lucky enough to, meet a doctor that's savvy enough to work around that and realize that, great, but that's not always the case, And if that is the case, the alternative that we have, they could order what's called the blood oxygen gas test, which I heard is very painful, but it would still be another way to say, hey, your oxygen levels are reading this, but I could tell it's not that. So now who knows, unless there was a study that went back to see how many people were impacted by that through COVID. Did that, sort of help to push along those that died? You don't really know, but it's something that's being looked at. There's so many. And I guess the fact that there's so many, that's disturbing in and of itself, right? When you go back to look at, chronic conditions, one of the things I came across, and I didn't want to get too much into the weeds, with stats, but I think I kind of got stuck when I looked just at New York State, right? Because I said, let me just do something easy. So, the top conditions primarily for blacks are heart disease, like you said, cancer, high blood pressure, diabetes, stroke, peripheral artery disease, and sickle cell, right? So, fine. Where I got stuck was one of the statistics I came across from 2017 to 2019. 35.64% of whites died before the age of 75. That number increases when you look at blacks to 56.5%, Asians 42.4%, and Hispanics 52.9%. So what does that mean? Does that mean that it's going to impact everybody? I don't want anybody listening to think, oh my God, this is going to happen. No, not necessarily for you. However, these are stats based on whatever, metrics they use in that control group. And whether it was 10 people, 20 people, 1,000 people, 5 people, I think that's enough for us to be concerned, So I would encourage people, again, You could look at it nationally. You could go to your own site, your state site, and pull up the same data, or the CDC to pull up the data. But again, just going back to New York State, the infant mortality rate is higher. Asthma rates are higher. Uh, Going back to Black, maternal mortality rates, those are higher. So I think this is the danger when you sort of don't have these conversations, when you don't advocate, when you don't ask questions, from people, from your providers, when you don't maybe take a look and see if you do have a particular prognosis, well, how do I fare compared to other groups or to whites? You may not think about your health care in that matter, but I think sometimes we have to think about it in that matter, just to remain, truly healthy.
Right. It's funny because I know the last conversation that I had on this show was one of the guests, she made a good point in terms of a lot of times people, as the patient and doctor relationship, and you may have a pain, and if the doctor is like, oh, I don't see anything, and you're elated because obviously you don't want to be sick with anything. However, deep down that you're not feeling well. You know what I'm saying? So it's kind of like, oh, the doctor said I'm good. And then hear that confirmation doesn't really mean anything, because at the end of the day, you're still sick. So the example that I gave, like if you have a headache that's been going on for a year, and your
You may
doctor's
want to
like, oh,
insist on.
yeah, if I don't see nothing, then hello. That's kind of where you really have to use a little common sense and either seek another doctor or tell your doctor, you know what, doc, you know more than me, but I think on this, I'm gonna need you to run some other tests. I don't know what test that you need to run, but you need to look in your little book
Figure out something.
and figure it out. Let's move on along this conversation because it's a lot to get through. Okay, so so again, forms of disparity, okay, race, ethnicity, gender, sexual ID, and the geographical locations. So why are these four so urgent in breaking down this disparity? And I don't know if you want to go through each four or maybe speak more about one, because I think the geographical location, I think you did hit upon that a little bit.
Well, I guess it's a larger implications, and I could go back to geographical because I just thought of another example, actually twofold. So we're all familiar with the tragedy that happened in Buffalo, right, at their supermarket. The other tragedy was that once what happened at that supermarket and that was taken away, it essentially created what's called a food desert, right? So a food desert means that you have no access to get food, healthy or otherwise, unless you travel long distances, which could be in and of itself become an issue for some people. Food deserts exist in the city. If let's say you have a chronic condition like diabetes and you want access to fresh produce, but you don't have, you have Joe Blow's supermarket near you, you don't have a large supermarket near you, or you don't have a farmer's market, that could have a larger implication on you improving your health and maintaining your health. When you look at a disease like diabetes, why is it that Blacks tend to have more amputations than others suffering from that disease? Is it that we don't want to take care of ourselves? That's not always the issue, So I think when that goes unchecked, you could get things like that happening. Also, you could be, let's say in a city, I can tell you, I think multiple hospitals closed before the pandemic in the city. And I would always ask this question. I see a lot of high rises, but we're not building hospitals. What's going to happen? I wasn't trying to speak anything to in existence, but literally a year before I was saying that. And then lo and behold, you see the pictures across the country, or at least in New York State, these long lines, nowhere to hold bodies and stuff like that. Well, what do you think is going to happen when you stop building hospitals or stop funding hospitals, right?
Right.
And primarily, I think what COVID did, and I keep going back to that because it helped to shed light on a lot of these inequities that already existed, right?
Mm.
So when you look and see, well, gee, I thought my city had enough hospitals, or where are these large lines or overflowing of patients happening? They're happening in predominantly mixed neighborhoods. Speaking again for New York State, you had hospitals like Elmhurst Hospital in Queens. That's largely a Latino and Asian neighborhood. You
Right.
had places like Brookdale. You have a large Caribbean population. But if you look at hospitals in wealthier parts of the city like Lenox Hill, believe it or not, they weren't flooded with COVID patients. And, there was kind of a mechanism where they tried to alleviate the pressure, but it was too much tied up into bureaucratic mess. So literally, by the time you got ready to transfer folks into the less trafficked hospitals, they weren't in any shape to be transferred, unfortunately. So that didn't happen. So you literally, not saying that they didn't see any traffic, but they did not see traffic to the levels of the city hospitals and the hospitals that you saw on TV. And I'm pretty sure it was like that with other parts of the country. So that's, looking at it in terms of geographic location. So just because you live in a city, don't think that you're immune to you're immune to certain issues that could arise.
Mhm.
And this goes back to just getting your regular health care as well. If you're getting treated for a chronic disease or you need some kind of special treatment, can you get it at your local hospital that's closest to you? How are you going to, if you can't, how are you going to travel to where you can get it, right? Um, Going back to gender, and, I think this goes to a lot of cultures, not just African Americans, but building trust, you know, um, whether it's trust to take medication, whether it's trust to even see a doctor, right? At some point, some people just don't want to go to the doctor. I got the home remedy, I didn't do that growing up, whatever, whatever. I don't need this test. Um, it could be a vaccine, it could be anything. A lot of people
Mhm.
just don't trust medical providers. So, when you think in terms of when you see stories, whether historically or present, are we doing anything to help that trust? There was a study I came across just this week. It was published. I don't have the name of the doctor, but I read about it through Black Women's Health Imperative, and they looked at hospitals that service Black patients right across the country. And what the study found was that Black serving hospital or hospitals that service mostly Black patients were less likely to be fully reimbursed by healthcare providers. So what's the domino effect of that? That means you're going to get lower quality
Right.
just by nature because they're not going to want to run tests, right? Because the first thing they're going to say is, I'm not going to be reimbursed.
Exactly.
So it's like a de facto segregation situation, if you will, right? Now, we know no one in this country wants to intentionally build in segregation or intentionally build in racial inequities, but these things become so ingrained. You got to think about it. If the foundation was this, right? If the foundation was built on certain things, it's systemic.
Mm.
It's systemic and it takes a lot to break away from that. So let's say my neighborhood is in, I don't know, South Carolina, right? And my neighborhood is diverse, but it's a lot of ethnicities, but not a lot of white people, whatever the case is. So our local hospital, the hospitals down there are probably spread out, is this hospital. It's smaller. The city hospital might be somewhere near the capital. I don't know. So just by default, you've kind of created a situation where it's not really a mixed situation. Not by
Mm.
anybody's, doing it on purpose. You see that here in the city, again, a big city. But if I walk into Lenox Hill, sure, you're going to see diversity. I'm not saying, I've had procedures
Right.
done at Lenox Hill. Um, but you may not see as much diversity if I go again to Elmhurst Hospital or Kings County Hospital.
Right.
Again, because the neighborhood is more diverse, right?
Mm.
As opposed to when you start changing zip codes. So again, overlapping with geographic is very important. overlapping with race and ethnicity, a lot of these things are kind of intertwined, just by nature. And I think the same study pointed out, like, I forgot the exact specifics, but of the Black babies born, almost a quarter were born in those situations in those hospitals. Again, depending on where you live as a parent, your hospital may be diverse. You're not going to that other hospital that maybe has different economic status or different, clientele that they service. When you look at gender, one of the other disparities, and of course, just being female and reproductive health, if you look at something very simple, let's say fibroids, and I don't want to simplify for anybody that has suffered from it. I'm not trying to, because I've had it myself, so I know it's not something simple. But you talk to any doctor, well, not the right doctor, and they will make you think that it's not anything serious.
Mm-hmm.
I remember I literally almost passed out from dizziness, and it was my primary doctor that said, "You are like one day short of needing transfusion," but I had no idea. you know, no idea whatsoever. And she's the one that said, get this, this, and this, not any particular GYN, because like you said, it's kind of dispelled, or nobody wants to talk about periods, or they're just chalking up like, okay, well, that's normal. No, it's not normal. So that's something simple. It's not, it's not something, well, it could be. I don't want to say it's not. I feel like almost anything can be a life-threatening situation if you don't address it. Let's put it that way. But if you keep propelling these myths that doctors sometimes can put forth, not all doctors, of course, if you don't find the right one, you yourself, like you said, you'll walk around, well, the doctor said it's okay. So what if I'm soaking up X amount of pads in a day? What does that mean? That doesn't mean anything. But, I think if we don't start having like high level conversations like this more amongst our communities, with providers, or demanding more, you're not going to see the situation get better. Know that there are studies being conducted out there. I'm not an expert in trying to read scientific reports. I'm not trying to say that. And that's why I said I like to myself also balance it with watching sometimes TV, whether it's docudramas, whether it's fictionalized drama, because you'll be surprised. And you've heard me talk about this a lot, like I'll go back and binge old episodes of ER, and literally it's relevant today. So many, from whether you're talking about gun violence, whether you're talking about what I just talked about, pain management, chronic conditions. What I like about the show is that it's an urban city hospital in a not nice area with not a lot of resources, with some doctors that care and some that don't. But I think it's a very true, realistic depiction, believe it or not, of what a regular hospital is. By contrast, for folks who may not be familiar with ER, you have, Grey's Anatomy, which is not my favorite show, but I have watched on more than one occasion because they hit on a lot of inequities, believe it or not, but from a different point of view because it's a wealthier hospital in Seattle. So they may not see as many of the, Medicaid patients or non-insured patients, but they touch upon a lot of the inequities and a lot of health conditions, rare ones sometimes, or like things like that EGFR score I mentioned earlier. They mentioned that on that show. So sometimes you have to watch certain things and pick out the information that may be relevant to you. I also didn't realize, and again, I don't know how many people, in different ethnicities would know this, but you could operate on a fetus while it's still inside the mother's womb.
Really?
And I did not know that. So again, there are some conditions that can be changed by a fetal surgeon, but how many hospitals in your area may have a fetal surgeon? So this goes back to, again, talking about where you live, the location, what resources you have, the doctor that you do see, will they refer you, or are they looking at, and I know we would say that we would probably revisit health insurance, but health insurance is another indicator sometimes of what you can or cannot have. So again, you don't have to be an expert in the terms. You don't have to be an expert in everything that we're talking about. What you have to be an expert in is asking questions. You can never go wrong asking a question. That's what I say. If
Right.
something doesn't sound right, um, is there alternative? That's not a bad question. You know, if
Mm-hmm.
you get pushback or if the person doesn't answer you correctly, that's an indicator you need to move on and look for another provider. That's what I say. You know, if you get a, you know, a funny feeling or whatever the case is. But yeah, overall they just it's each one I don't even think stands on itself when you look at the, you know, the top fours. I think they kind of are intertwined, right? If you go back to look at sexual orientation, and what's going on now with the LGBTQ plus community, I apologize if I didn't hit all of, you know, all of the letters, but so you already have it stigmatized as, you know, primarily within the gay or bisexual men. What's already beginning to happen, and I think I had read this also this week, they're now going to release testing data, right? Because up to now, there's no data in terms of, if you wanted to look for it, how many test positive, how many people have gotten the vaccine, that has not been published. But what is apparent, and this is just me looking at social media, is that more people are telling their story and sharing, and you're
Mm-hmm.
hearing more folks of color, again, within that demographic, not getting the vaccine or not getting the, I think it's called TPOXX treatment that is available.
Mm-hmm.
So, again, are we repeating, you know, things?
It's funny. It's funny. It's like everything you're saying is on point because a friend of mine who is also an advocate, he shared on his feed like the situation that he went through trying to get this TPOXX vaccine, and it was
Mm,
just heart wrenching to hear like what he went through. So I kind of want to back up just slightly. Okay, so when we speak about, okay, I forget in what term you mentioned it, but in terms of the trust of the patient with the doctor. So when you have doctors who get certified, who get their degrees, who get all of that, and then they go upon and find a job at a hospital, I think it's so important, just like when we have our police officers who may not be from that neighborhood,
mm,
to see who is in this community. Who am I serving? Because at the end of the day, you are serving that community. But if you're not in tune as to what this community is about, and
right.
perhaps just looking at the color, oh, they're black, or oh, they're brown, or oh, they're Asian, you're not really doing your most as understanding the culture, you know,
Exactly.
and to try to sway that whole misconception. If I go to the doctor, will I come out alive? I remember when I was
Mm,
younger, and it was this family friend we had, and her mom, I don't remember her because I guess, I don't know, I forget how old I was. I was like an adult, but young adult. But it was
okay.
something other avoided hospitals. That was like a big to do.
Mm,
And she went into the hospital. Lo and behold, I forget what health issue she had because she hadn't gone to the hospital in so many
wow.
years, and she ended up dying. So it's like that
Mm,
whole thing of, I think a lot of people, that fear of, if I
right.
go to the hospital, if I go to the doctor, they're going to tell me something horrible, especially if you haven't gone to see your primary care
In a while.
doctor in 5 years. You know what I'm
Five,
saying?
probably longer.
Or
Probably
longer.
longer.
You know what I'm saying? So there's a little bit of this and a little bit of that, and making the brew for this tea. You know what I'm saying?
Yeah.
And just as you say, have we learned, even with the misconceptions, with trying to identify certain diseases or ailments or whatever with gender or sexual orientation, it's just
Mm,
like as educated as we are in this country, speaking specifically in the Americas, it's just like, are we learning?
I don't
Like
know.
we have all of these research papers, and these people do whatever. We're not in that life, but for those who that's what they do, are you learning it, boo?
Right.
Okay, because it just like our children will probably have this same conversation in the next 30 years or something. It is still not resolved. It's still like this merry-go-round of foolery,
Hopefully not.
I don't know.
Hopefully
I'm
not.
like, the future is looking very bleak in terms of the stuff that's kind of going on. You know how I feel with that. But just to move this along. So okay, so we spoke a lot. I know you mentioned a little bit, okay, in terms of what were the common health concerns for the Black community. So we spoke a little bit about heart disease, hypertension, cancer, diabetes, PAD, peripheral artery disease, and sickle cell disease. So okay, what are the top 5, I guess, in terms of that lead to death, if you will, because they're all pretty significant to some
Right,
extent.
right. Well, again, just looking at, because I only sample like from my state, the top 5 would be heart disease, cancer, diabetes, stroke. Um, Really, well, I can't even say top 5. All of them would either lead to disability or death.
Mm-hmm.
And if you pick apart again, like when you look at it in terms of blacks, Asians, Hispanics, and whites, the outcomes differ. I think for cancer, lung cancer, the rate was higher in whites. All the other cancers, no. So
Right.
cancer's again, the disparity was obviously leaning towards blacks, then Latinos, then Asians, but lung cancer, it was whites that led the way in terms of prognosis and deaths. But everything else, it should be fair game if you would think about it, but it's not, and why, is
Mm-hmm.
the issue. And, I want to say it doesn't always. Sometimes it comes to mistrust, yes, a distrust of the medical community, not going to the doctor, not doing what you're supposed to do. But sometimes it also comes with, hey, I went to the doctor, but they're not hearing me.
Right.
They're not changing my medication, or they're not telling me what else to do besides take the medication. So you do have people that are trying to do the right thing. And this is where, and I get it, we all don't feel comfortable being advocates. It doesn't come naturally. So sometimes, maybe take someone with you, maybe find somebody on that medical staff that could help you. I know I've done that in the past. There's been somebody that, a nurse or whatever that I could kind of lean into and talk to. But you have the right to question some of these things, particularly if you have diabetes and it goes from 0 to 60 and you're doing everything supposedly that they're telling you to do, but maybe there's something else that the doctor didn't mention that they kind of took for granted that you would know to do. It could be something as simple as, I don't know, lose weight or
Right.
whatever the case is. Um, I did know someone, but that was totally kind of self-inflicted because they knew. So they went from, testing their blood sugar to having the first bout, what you call an episode, came out of that. Okay, now I have to, take insulin. Still not going to kind of do what I have to do. They ended up in a coma for almost 3 to 4 weeks, was going to die. Luckily, that happened when they went to the hospital, so oxygen loss wasn't an issue, but they did awaken without their eyesight. And it took that,
Mm-hmm.
unfortunately, to say, wait a minute, I've got to take this seriously. So sometimes, and again, this is someone, they went to the doctor, but, and sometimes this is where gender comes in. I'm not saying that all men do this, of course, but, sometimes with men, they kind of like pacify or say, it's not that serious, or, I feel strong, whatever the case is now in this moment. But if you don't take the precautionary measures you need to take, you don't know what's going to happen, right? So something that was treatable has now gotten out of control, essentially, so to speak. And I've seen that this particular friend was Spanish. I had another person that passed away. He was Jewish. And literally, I remember we had this conversation. His diabetes, he wasn't taking care of himself. He lost one toe, went back again, got infected. I mean, literally, he was going toe by toe. And it got to the point, he's telling me his version, then he's telling me what the doctor would say. And again, this was all Jewish providers, that's all he dealt with. And I think he was questioning the doctor, why do I have to keep going back in? Like, why aren't you just doing everything in one shot? And I think either I can't remember if he wanted to take more of the toe. I guess at this point it was like, look, I can't keep going through these surgeries because I'm having complications. Just do what you have to do. And I said, it sounds like you need to get a second opinion. Again, because I'm not an expert. I could talk to you, and based on what he was saying, I said, just get a second opinion. The doctor told him, if you get a second opinion, I'm not going to see you anymore. Then we won't see you anymore. And unfortunately, during COVID, he passed away. I'm not sure. I know he went back into the hospital again because of an infection, but I don't know if it was, due to the infection or due to COVID that he ended up passing away.
Now, girl, okay, this is where, just as you mentioned, like, not everybody has to be vocal, like how we're doing as being, we're patient leaders or advocates or what have you. Okay, no one says, because not everyone may be comfortable sharing their story or whatever the case is. However, when we say advocacy, that is advocacy for yourself. Okay?
Yeah.
It's that relationship with you and your doctor in that little bitty room with the 5 minutes that you have of his time. So that's just mortifying, just to hear that going through each toe instead of doing what the hell you supposed to be doing.
It was the craziest thing. And one day I'm just like, what is going on? Like, what is going on? And then, he again, like I said, all of his providers were, because sometimes you do feel comfortable seeing someone of your own, race or ethnicity. So all of his providers were Jewish. He always said that. And I think it hurt him to hear that from this person that he trusted, as his medical professional. And the thought of, having to go outside of that comfort zone, but knowing that what you're saying is not correct. This is not right. What's going on, I may not be an expert. I know this is not supposed to happen every time that you perform a procedure on me, and again, I don't know, what that last procedure was. And then of all times, again, this was like at the height of the pandemic, to have to go to a hospital where pretty much all the hospitals were inundated with COVID patients. Something routine, did he end up getting, exposed to that? And that was his concern too. He didn't want to go, but it got to the point where he had to go because there was obviously something wrong, with the wound from the procedure.
Right.
Yeah.
So I just want to piggyback on what you said before I move to the next point. But in terms of having that comfortability, being comfortable with your provider, I've had certain situations. Sometimes that don't fly. So I don't go by, if you're Black, I need a Black foot doctor, or I need a Black, no. Okay, because I've had not the best experiences. Okay, so I kind of go by the gut. Okay, you can never go wrong with your gut. Like if you come in there with an attitude, like, I better see some teeth, I better not see any kind of thing going on with you, because that's the Brooklyn.
That's a deal breaker.
Okay, I could just, that right there gets my antennas up, and I'm already in defense mode. Right. And I'm thinking, okay, when I leave here, I'm gonna need to go through what other provider to speak to. Now, luckily, that hasn't been the case. Like, it all depends. You know, I ain't
Yeah.
gonna this conversation that this could be another whole special episode, to be honest with you. So we're gonna move on from that little point. But I just wanted to like add my 2 cents in terms of that's not always the case. You know, you
Right.
want someone who you're comfortable, who you can speak with, and sometimes that is the case. But then sometimes it's not, because
Right.
each
And I think that
doctor,
was a situation where it wasn't, but if it's so, I guess it was ingrained in his mind, this should be the case.
you're
But
right,
clearly, it
it
wasn't.
wasn't
That wasn't the right.
exactly. Girl. Okay, so how do you think these vexatious disproportions affect everyone? Because that's part of tonight's conversation. This isn't a black thing
Right,
or
right,
a
right, right, right.
Spanish thing. You know, this affects all of us to some level. So what do you think on that?
Um, I think you could say it's based on it's going to impact everybody. You're right. So like you said, it shouldn't be just based on race. Obviously race, gender, all the other disparities that we named have larger implications for overall health for everyone. When you tend to, try to put things into perfect boxes, it doesn't work that way, right? So if you pick apart, say, for example, and I know this is not well, everything overlaps, like a healthcare situation, in terms of insurance, uh, I don't think race factors in. It could factor in, but I pretty much think a lot of us feel like, you're going to get that bill or you're going to get faced with out-of-pocket expense or that medication is not going to be covered. Um, Other factors may come into play in terms of who's going to be impacted more, but I think healthcare in general and insurance is something that everybody's going to feel the pinch with, right? Because money is money, no matter what color you are, right? So either you have it or you don't. And that's when you start thinking about marginalized communities and it may not be a community of color, it may just go by socioeconomic situations. Um, when you look at how it impacts everyone, there's another term that I came across during training. I had never heard of it before, and it's called social determinants of health, right? So when you talk about a social determinant of health, it's basically the differences between two groups within healthcare that stem from broader inequities that already existed, right? Whether it's some examples would be education, access to and the quality of. It could be socioeconomic again, doesn't matter the race, but it matters, what job access do you have. It could be based on your neighborhood or your built-in environment. Again, if you live in a town, I'm trying to think, I think Detroit now is getting a little bit better. I'm not exactly sure, but at one point, when the automotive industry pulled out of it, I remember seeing something on TV and they were talking about, and again, lower class, you take those jobs away. Now what jobs are in that community? So I think this ran the gamut no matter, who was there. A lot of access to just things as being able to call 911. Nobody came. Could you imagine you have a fire and who's coming in this country? It's not a third world country, right? So social determinants impact everybody. They're preventable, um, but if left untreated, it could limit or support, right? It could be the opposite. If you live in a healthy, wealthy neighborhood, then you may have access to everything. Food markets, local produce, a great hospital, extra treatment centers, I don't know, a yoga studio, you name it. So it could go either way. Then you have a structural determinant, right? So structural determinants are based on policies and practices that are also in place, but that can influence whether you're going to have good access or not. And going back to that study, if I'm going to a hospital that's predominantly year after year underfunded, I'm not going to have access to that quite, high level of treatment as opposed to another hospital. Um, trying to think of what else would be a structural example. Guess you could say this kind of overlaps with your neighborhood and built-in environment. If to get to my doctor's appointment, I have to pass the local street corner where there's gang violence or shootouts, how am I going to get to my appointment? Or if I have to get to a school, and again, we would like to think something like, many people don't think of gun violence, how does that factor into this conversation? Because it is a health epidemic. It absolutely is. If you live in certain pockets of the country and you're repeatedly exposed to that, that's creating trauma. Trauma is real. PTSD is real. That's called mental illness. So it is a health issue. And I think the CDC has declared that as well. So again, if this is your built-in environment, should that be natural? Should you fear going to the drugstore, going to school, going to work, or looking at work, right? We know, and again, I know I keep going back to COVID, but COVID really highlighted a lot of things. There are a lot of frontline workers. I think biracial breakouts a lot predominantly go to, Black and brown community, but not all. But the folks that had to report every day in person or had more public contact were more prone to getting COVID in the early days. They didn't have the luxury of sheltering in place at home or working remotely. If you're a police officer, you can't do that remotely. If you're a firefighter, you can't do that remotely. If you're an EMT transporting sick patients, hospital workers. I know a doctor I know was telling me, she had to fill in, of course, for her peers during the pandemic. And she said morale, which I still think to some regard probably is very low among some in the medical community, because they were forced to work. And I know we say, and we do respect the fact that they were our leaders, they were our heroes, but they are also human. They also did have families. And I don't think anyone, when they took that medical oath, pictured what happened in 2020. Let's be fair. I know what we expect, but let's be fair. That's the reality. They didn't expect that. So with that said, she explained to me morale was low because as they're telling people to work these ridiculous hours, come in if you're sick, because even then they were saying, oh, your fever is gone, just come in, because they needed staff. The executives in the hospital were where? They were working remotely.
Right.
You're the folks that at least are supposed to be ensuring that you could transfer patients, that you could use resources, and you couldn't even do that right. So yeah, it's when you look at those two things, I think it helps to put in perspective how this really impacts everybody, any disparity, any, social determinant. These are things that we all should be aware of. And maybe even, self-reflect and think, well, what is my built-in environment? Am I in a place where I'm set up to have a healthy outcome? And if not, do I know how to position myself to get that? Because maybe I live I can live in a working class neighborhood, do I have insurance that's going to cover me asking for a provider elsewhere? Am I locked into a certain provider? And if so, maybe I could still find somebody good there because, you could go to any public hospital. Again, I keep going back to my ER reference. And what that show highlighted very well, yes, it's a teaching hospital. Unfortunately, when you go to a teaching hospital, you get mistakes, but you do have good doctors there, or you do have resources there that you could utilize. One of the other things that my children's pediatrician pointed out to me, because I remember asking her very early on, where were the best hospitals to go to? Because I'm thinking this happens again, where to go to. She said, obviously the ones, in the wealthier zip codes, but she said a teaching hospital is going to get the most resources. Because I remember here in New York State, we have Downstate, if it's still called Downstate. They might have changed the name. They were one of the first hospitals to study what has now been labeled long COVID, right? Because nobody knew what it was, but they knew they were seeing patients who no longer tested negative, who should be okay, but were saying these strange things were happening. So they kind of did they had the funding, I guess. They didn't have to ask for extra funding. They probably have extra funding now, but they established the very first clinic that I know of in the state to look at and have those patients come back. You know, so a teaching hospital, a lot of times we cringe, you know, you don't want anybody, whatever the case is, but you know, don't close the door necessarily on that. And I feel like every hospital is a teaching hospital to me, or maybe
You
that's
know,
just me,
as just talking, I
right?
think they are. I
I think
don't
they
think,
are.
especially nowadays, I don't think, like as you say, too, a lot of the hospitals in New York and throughout the country, a lot of these local hospitals have closed. So,
Right.
okay, to some degree, doctors gotta learn, you know, so it can't just be one, oh, this hospital A is the teaching hospital.
Right. Right. Right.
Like when you think about it, they all kind of have to open up the door to have these interns or whatever you call the doctor people.
Exactly. And I guess, you know, sometimes, you know, you figure, well, if I'm knocked out, because I'm thinking I had a surgery, I guess it's about 6 years now, um, to have when I had my thyroid removed. And I think I remember groggily waking up, but I think she had explained, and that's the other part of it too. If a doctor is very open and talks you through the process of what to expect, you know, I didn't feel a certain way about it. So she had already said, you know, given what I had going on, it was a very unique situation. So she would probably have, you know, she explained it to me, whatever you call them, interns, whatever, around. I think it was about five in addition to her, but she would be the one doing what, because that's a very important question to ask. And you have
Right.
the right to ask that. She would be the one doing whatever she had to do. I think the only thing I had, what do they call residents or interns? Do I had a tube that had to be taken out. I remember eyeing him like, you know, why can't she do that? Because you know, are you going to do that kind of thing?
Be patient is safe to say. They don't want to be that person where you're kind of doing whatever.
Right.
Like if we do the flip side, you know, to kind of go over here on this side. For those who are on or who listen later, who've gone through a bone marrow biopsy or aspiration,
Mm.
that is hurt. Okay, that's all I'm gonna say. So for me, I know I'm always giving people the rundown, especially if I don't know you. Okay, because what we're not gonna do, okay, is you be a newbie sitting here. You know, I've been in this game
No.
for 15 years now. So I kind of know what to expect, you know, all this, that, and my comfort level is like up here when you're getting that particular procedure. So I'm not trying to hear, oh, this is my second one that I'm doing. Okay,
No. No, no, no.
where's my doctor?
Mm-hmm.
Like, and people know I'm crazy anyway. Okay, love you advocates, but that's the real. Okay, so yeah, what you ain't gonna do is give me something like brand new, because I ask
Right.
all the questions usually before that appointment. Who's gonna do
Exactly.
it? How long they been doing it? Are they new? Like, did you just graduate? You know, yeah, we ain't doing that.
Exactly. Exactly. That's so important. It really is important. But sometimes people don't know to question that, or that they
Exactly.
can
They kind
question
of
it.
go with the flow. Exactly. And
Can I
you
question it? You
learn.
don't know
I
that.
think you learn. I think if you find yourself in pain that has been inflicted upon you, okay, I think maybe I should open my mouth out and say. But if you just hang in there and just go with the flow, like I said, sometimes we gotta use just a little bit of common sense.
Right.
Sometimes you keep it bottled in. Oh, I should have said something after they didn't poke you in the needle, poke you with the needle, and oh, they missed it. It should have been the right hip. They went to the left hip. So now they got
That's
to do
happened. That's happened. Yeah, unfortunately, sure.
like,
Yeah.
so you just want to set up yeah, that's where the advocacy comes in there, where you, okay, now enough is enough. Okay,
Right.
let's
Right.
now speak up because something is wrong here, you know. So I want to wrap this up. This conversation has been
Sure.
superb, but okay, what actionable steps can our viewers now and our viewers who come on later, what can they take control, you know, how can they take control of their health and moving forward? What are some actionable steps as to kind of move this whole disparity in healthcare? What can
Well, you have to stay informed. Again, whatever's the easiest way to do that. Like I like, reading about science and, keeping up to date. If, you're a social media person, the quick way is to follow. Everybody's on social media, right? Whether it's Twitter, Instagram, Facebook. So almost every major health entity has a Twitter handle or IG handle. So if you're someone that has a short attention span, just follow that. You'll get a blurb from a headline. Maybe that's enough. You don't have to go dig deep. This is something that I like to do, so sometimes I will dig deep. You don't have to do all that. But if you stay in touch, if you're on your phone anyway or on social media and just do that little thing every day, you'll be surprised how much you can learn and how much it would apply to you, right? Um, Self-advocacy is not for everyone. You may not feel comfortable speaking up. If that's the case, if you have someone that can, if they could, join with you, go to your appointments, that's great. If not, believe it or not, every hospital, and I think you and I have talked about this before, has a social worker. They may not be as accessible, but you can ask. That's another thing, you can ask. Oh,
Yeah.
what's that? Every hospital has a social worker. If you have a
Okay.
problem paying your bill, if you have whatever it is, they have someone, right? And if they don't give it to you, then that's when you have to start demanding, well, who's in charge of this hospital? Who's in charge? You know? Better yet, we all have, wherever we live, right? We have council people, local elected officials. If you're not getting the answer you want, again, it may seem overwhelming, but all of those people also on social media. Get a phone number, call. You can get, somebody has a comment in the chat. You can get those answers. You don't have to know the answers yourself. So again, being informed doesn't mean I have to have a PhD behind me. I have to get some special certification. Again, whether you want to turn on the news, whether you want to follow somebody on Twitter, or whether you just want to ask a question, right? How can I find more information about this? Is there a support group, right? Believe it or not, and I know depending on the community, we're like, what's a support group? Is it therapy? It's a opportunity to engage with others that may be going through what you're going through. Maybe they could advocate. Maybe they have an answer to your question. So now that gives you that peer-to-peer if you're kind of intimidated by a more formalized structure, right? So don't belittle that as well. When it comes to, asking questions again, if you have a medical provider that seems challenged by the fact that you're asking, it could be a simple question, or bothered or annoyed, it's time to look for another provider. Sometimes they will, we're all human. I'm not saying that everybody's going to be perfect every time, but let's say you've gone to this doctor 10 times, and 10 times they haven't smiled at you, asked you how you're doing, answered your questions. Okay, are you going to go the 11th time before you realize I'm supposed to have some kind of rapport with them, right? I'm supposed to get some kind of comfort with them. If I'm not getting that, like you said, trusting your gut, I think that's probably the most important step you could take.
It's
Trust
a
your gut.
leverage. It's really a leverage. Like, I'm thinking of my situation. I may have a doctor, or one of many doctors, and that may be how they kind of move, where they're very stoic, blah, blah, blah. But I've seen them into action to know that they're very good at what they do. They
Right.
just don't, I won't say have the best bedside manner, because if that's the thing, that's some things I just don't tolerate. But
Right.
you just may have some, they'll ask how you doing, but
Right.
it's like chatty, like, yeah, doc, I was at the club last week and I stomped my toe. Like, we ain't getting that comfortable,
Right.
you shouldn't really be that comfortable anyway with your healthcare
Doctor.
provider. So here we have Patricia said, you must ask questions, know your body. If you're not confident in your medical provider, switch immediately and always ask questions about your care, which is true. That's like everything
Yeah.
that we talk about. I mean, it's quite simple, but some people do struggle with it.
It's intimidating.
Apparently,
Yeah,
you know, and it can be
absolutely.
intimidating.
Yeah. And you know, like I said, my favorite way again to put things into perspective and really which is always a catalyst for me is entertainment because that's like one of my other hats, you know. I like media, you know, I write, so I tend to gravitate to real life stories or fictionalized dramas based on real life stories. And you'll be surprised how much you learn, you know, from that as well. So again,
Mm,
not everybody's a reader. Not everybody watches the news or can sit still, but I encourage you to find the method that works for yourself because I think right now being uninformed is not really acceptable, right? Whether you're talking about moving through a pandemic, you know, maybe you think all is good because you're looking at Joe Smo across from you or they're not wearing a mask or whatever. Make your own decision. Don't worry about what somebody else is doing. You know,
mm,
if you're going to engage with your family or friends, and they're trying to give you advice, to me, with the way I always start things out in that conversation, at some point in that conversation, what did your doctor say?
mm,
Because I'm not a doctor. You're not
mm,
going to come after me telling me, you know, I'm not a medical provider. You know, what I do is try to coach, you know, and guide you, but ultimately it's got to be your decision with your medical provider, a medical professional. You know, you weigh the odds, we'll talk the odds out, but I can't make that decision for you. And you shouldn't make that decision based on what Aunt Sally said they did back in the
mm.
day, you know, drinking some concoction or what
Guess
that's
what?
called or whatever the case
COVID,
was.
to be specific, COVID wasn't around when Aunt Sally and
Well,
was,
that too, right? Well,
you
I
know,
can hear, I can definitely hear some people kind of referencing that, like, oh, this is no different. It is different. Right, it is. It's something that no one has seen before. So, if for no other reason but that, you know, yes, there are things that I'm hearing about that are coming back, but that was different,
mhm,
you know. So, no, what you did back in the day is not going to help you. The only people I would listen to, and I was telling somebody this the other day, are, you know, the tribes that we have all over the world that I'm sure are untouched or unfazed by all of this because
mhm,
they know something we don't know.
right.
Right. And that's also a whole nother topic in terms of, you know, climate change and what we're doing to the environment. But I guarantee you, without a doubt, they are sitting untouched. So those are the real experts, right?
Right. They're like, don't come over here. Okay, basically. Please do not come in our community.
No, we good, right? Without the electricity, whatever, we living off the land. They have true medicine people. They're good
Exactly.
because they don't have this. They don't have diabetes. You know, they don't have all the stuff that we have here. So, but yeah. And again, you know, I don't think I mentioned my website, but at mels2021.com, you know, that's what I really wanted it to be, like a one-stop shop for people to visit. You know, we do weekly features on various topics. We do monthly features on various topics. Right now, one of my other things is delving into, again, how violence leads to trauma and how it impacts people of color. So, you know, you can visit, that's a resource or whatever resource that you find. You can email me if you have a question, info@mels2021.com.
And what is
I'm
your
always on,
Instagram handle?
my Instagram handle is Mel underscore MEL underscore DEE. Is it at 21? Looking at my business card. No, it's Mel underscore D 2021.com. And let me just I'll put that in the chat.
Okay.
And then my Twitter is at Mel's Quarter 2021.
Okay. So this was a very important conversation, very informative, you know, for those who are able to pop on. I hope you guys learned something. I hope it enlightened you a little bit in terms of the struggle is real. You know, the struggle is real and it's an ongoing conversation. You know, it's just something that
Definitely.
you really have to do, you know. So part of an extension of tonight's conversation, we have like resources. So we have clickable links if you go to the bio for myeloma chick. So I have some clickable links in terms of some resources that you guys can continue to learn more in terms of the materials and the information in terms of disparities in healthcare. So that way, if you didn't know that it exists, guess what? You can learn a little bit more about it, how you can improve your own journey, you know. As I always say and will continue to say, I hope you guys subscribe on YouTube. Okay, so
Definitely.
those videos are also on my bio. You click, there's like a couple of things on it. It's the website and it's the courtesy resources that we have for you. So just to wrap up quick, next month we have another special presentation regarding on the caregiver's perspective, as this has been an interest for many of you to have this conversation. So we're going to bring my little hubby and you want one. So that should be quite interesting. So stay tuned for that.
You have a date for that one?
So much, everybody. Huh?
You have a date for that one yet?
I do, but I'm not putting that out there yet because that may change. But it'll be next month. It'll be next month. This, you know, my schedule.
Yes, yes.
And then with his schedule, yeah, we'll figure it out.
Okay.
But I want to thank you, my friend. This was amazing.
Thank you. It was. I had a lot of fun. A lot of fun. You could go on and on with this topic.
It is a very deep conversation. We didn't even delve a little into the clinical trials. Maybe that'll be something that we hit like another special. You know, there's always room for different specials and stuff like that. So I want to thank you. I want to thank our viewers today who were able to come on. I saw we had some activity going today.
Yeah.
So that's very positive. And for those who listening on the replay will be available on YouTube. Check out the YouTube channel. Again, all of those details are in the link bio on Instagram for Milo Chick. So again, thank you, sis. And you know we're going to switch up and do another show.
Yes, absolutely.
End of the year, we'll figure that out.
Thank you for having me. It was a pleasure.
Thank you.
And thank you for doing this.
Everyone.
Take care. Good night.
Bye.
Bye-bye.